This is All India Radio. In the program Spotlight now, we bring you a discussion on Prime Minister Swasthya Suraksha Nidhi and healthcare initiatives for the citizens. The participants are Shekhar Iyer, political analyst, and Aditi Tandon, journalist.
The Union Cabinet, chaired by Prime Minister Narendra Modi, yesterday approved the Pradhan Mantri Swasthya Suraksha Nidhi, which is a single non-lapsable reserve fund for share of health from the proceeds of health and education cess levied under the Finance Act of 2007. The cess that was earlier announced by Finance Minister Nirmala Sitharaman in her budget speech. As we all know, Mr. Iyer, that during the budget speech, the Finance Minister stressed hugely the well-being and health sector. In fact, listing it as the very first pillar of the 6 pillars that she used to build the budget for this year, because it's a COVID year and the last year has actually been devoted to the management and response to COVID. So the fact that this particular fund will not lapse at the end of the financial year is a very important indicator. And also it is important in the sense that it helps to enhance access to universal and affordable health care by ensuring availability of earmarked resources. Because in health, the issue has always been budgeting and public spending on health. And the idea is to actually take public spending on health to a minimum of 2.5% by 2020. Although we are far from that goal, but attempts are being made to reach there. How do you see yesterday's decision of the cabinet?
Indeed, Aditi ji, as you mentioned, this is going to be a non-lapsable fund, which is basically addresses the problem of budgeting and also the problems faced by our planners in the health ministry and other experts. What happens is when they look at 2-year plan or a 3-year plan or a year-to-year plan, often the problem comes how to handle the funds, because many cases they lapse. Then again, you have to go through the process of getting fresh approval and then fresh allocation. This is to do away with all that. As the name suggests, health and education cess is collected with the aim of addressing the education and the healthcare needs of very poor families in India. Now, with the cess, unlike other tax, cess is collected for a particular purpose and cannot be diverted for any other. And the other thing is that this cess applies to all the income tax assessees. Everybody pays tax. In fact, this cess was first introduced in the Union Budget of 2018 by then Finance Minister Arun Jaitley, who had replaced the earlier secondary higher education cess of 3%. Now, since then, this cess has been collected because the normal case is that tax goes to the consolidated fund, which can be used for any other purpose. But when you earmark it for education and health cess, then it is only meant for this purpose. So it cannot be used for any other purpose. And also in this year budget, as you mentioned, the post-COVID scenario where the government has decided to double our budget because the health spending has now gone up from 94,492 crore. It has almost gone to 2,23,846 crore. As you mentioned, Nirmala ji specifically mentioned about health and well-being. The whole concept is both preventive health and taking a look at the holistic health. And of course, this year, the large part of this budget is going towards meeting the COVID-19 vaccination, for which 35,000 crore has been allotted. Because the government's aim is to eventually increase the health expenditure up to 2.5% of the GDP by 2025. Even in the economic survey, it was estimated that an increase in health spend, even if you let it go up by 1%, say from 2.5% to 3%, that can decrease a lot of out-of-pocket expenditure that keeps happening. Something like when you are providing over healthcare, which is not in a very planned way, that means a lot of money is spent in different heads. So the whole idea is to do it in a more systematic way and focus on those 3 important things. One is Ayushman Bharat, the health wellness centers. The second is the Jan Arogya Yojana. Then also the National Health Mission, which has again 2 components. You have the Rural Health Mission and the Urban Health Mission. And the other important project that the government has is the Prime Minister Swasthya Suraksha Yojana.
I would like to draw your attention to the Parliamentary Standing Committee report on the health sector that was tabled in both the Houses of Parliament 3 days ago. And an important observation of that committee was that while the committee applauded the government for the fact that health and well-being as one holistic sector has been clubbed for the first time in a long time, because as you would remember, Mr. Iyer, the National Health Policy of 2017 had actually argued for a holistic approach to health, and it had said that the government should stop looking at health in silos. Like, for instance, for the first time, Finance Minister, when she declared and announced her budget estimates and provisions, she mentioned how she's clubbing various sectors under well-being, for instance, health as well as water and sanitation, Ayush, the package for vaccination, nutrition, as well as Finance Commission grants for water and sanitation. So the entire budget put together came to the figure that was actually 137% over and above the previous budget estimates. But of course, if you look at only the Ministry of Health and Family Welfare, it was 32% of that overall budget. So that is the reason of this particular discrepancy. But nevertheless, the government has started moving in a direction of holistic approach to health. How do you see the fact that a lot of sector allocations have been clubbed under the well-being segment? Because this is the first time we are seeing such a shift.
Indeed, Aditi, the fact that it was not being looked at in a holistic way, because essentially it was thought of, looking in terms of improving primary health care, then improving the tertiary care, then looking at the district hospitals, then you had the system of creating AIIMS-like institutions, then there was a talk of multi-speciality hospitals at district level. And the other idea was that you look at the prenatal and postnatal care. There were several things which by themselves they were projects. But to look at it in holistic terms means if you are concentrating on, let's say, preventive health care. So that also requires you look at the basic hygiene kind of that is available as a quality of life. So we are paying attention to Shauchalaya in terms of creating toilets. Then you are looking at sanitation also by way of providing safe drinking water. So that is why the Jal Jeevan Mission also, 5 water supply, is also an element of health. Once you start looking at what leads to a situation where you have diseases, where you have issues that raise a serious health management issues, so you will have to tackle everything. And that is only possible just as the health ministry will be focused on in all these yojanas, looking at improving the health infrastructure, the other departments which are engaged in providing the other facilities, which is actually improving the quality of life and increasing the standards of hygiene. So I think this coordinated approach is something that the Prime Minister has always been emphasizing. Let's not ministry look at their, just reaching their own particular schemes and implementing them, but work with others also. If you are going to create some infrastructure facilities, let it also be understood. The basic idea of the government is to prevent as many people as possible from actually falling ill and needing medical attention. Of course, in any health infrastructure, we'll have to look at emergencies, we'll have to look at general health standards that are there. But at the same time, I think it's the first time a lot of attention is being taken to at the preventive health aspect. And that preventive health aspect looks like holistic. And along with that, we are also seeing the kind of importance being given to the other forms of medicine. When you are talking of Ayurveda, when you're talking of wellness centers, when you talk of wellness itself, it means that the focus on health, which is actually the most in way of looking at it, is not just focus on treating the people who are sick, but also create those facilities which prevent actually people from falling sick. So I think that is the basic philosophy which is driving this government's approach towards the health sector.
Mr. Iyer, India has performed much better than many countries in controlling COVID mortality can also be attributed to the design of prevention, in the sense that if you recall, Mr. Iyer, that through massive outreach, Prime Minister Modi engaged the citizens of the country on several occasions during the COVID pandemic, telling them how important it was to wear masks, how important it was to keep a distance. I think it was the COVID appropriate behavior and the sense of responsibility that Indian citizens actually showed through the pandemic that stood us very well during the pandemic. Otherwise, you look at countries like the United States of America and the UK with the highest ever. They have such high percentages of GDP dedicated to public health structures, and yet they could not prevent mortality. Perhaps the focus on preventive health and citizens' responsibility in this movement helped us a lot, didn't it?
Absolutely. Our general impression always been that in a country like ours, where the health infrastructure requires a lot of upgradation, we were actually wondering how are we going to tackle this problem of corona pandemic. But right from just a year ago, when the WHO actually declared the pandemic is on and every government went official with the the crisis that was looming large, we saw our government looking at whatever is possible and whatever it takes. That is why you saw a campaign to include the people's involvement. Because that was a big thing, and that started with personal hygiene. Washing of hands and wearing masks was one aspect. The second thing was whatever structure we already have, whether it is your primary health care centers, whether it is your district hospitals, or whether your bigger government hospitals in big towns or cities, everybody was geared in, and where the health workers particularly were mobilized, enthused and inspired to do their bit. I mean, if you just take a flashback, I can imagine those days a year ago when everything was an issue, whether it was availability of oxygen cylinders, whether it was question of ventilators, or even the question of PPE, personal protection equipment. If you just look at that situation, it seemed that it was going to be a stupendous and Herculean task. And often there was a lurking fear, will our system creak and collapse? Because so many people, and if a disease like this can spread, it can cause havoc. But the fact that the government was alert, and the fact that with whatever we had, we decided to do our bit. In contrast to Western countries where their health infrastructures are far superior to ours, and in terms of catering to the population is also less. We saw what happened in large parts of Europe and particularly the United States, where the previous administration took a view that this was not such a serious problem because they were more worried about the impact on economy than on the people. So consequently, despite the infrastructure, despite the superior quality of medical facilities available, the fact that there was no coordinated approach, the fact that the people were not involved, sort of a movement like it was done here, because a lot of people were actually wondering, what purpose would be served by all those calls given. If you remember last March 2020, when the Prime Minister gave a call to light candles or to clap and all that, many people thought it was some kind of a joke. But it was not, because it spread the people's consciousness. That was a big role, playing that preventive aspect.
Coming to your earlier point about Pradhan Mantri Atmanirbhar Swasthya Bharat Yojana, Mr. Iyer, I think the large focus of this scheme is also prevention and surveillance. I was looking at the nuances of this scheme, and it says that a key learning from COVID has been the strength of India's integrated disease surveillance program, which is led by the National Center for Disease Control. Perhaps not many people know, but out of 734 districts of India, 730 districts actually have an IDSP center today, which actually helps us to detect disease, test, track and treat, which was the soul of the COVID response in India. And the Pradhan Mantri Atmanirbhar Yojana, which will have an allocation of 64,180 crore over 6 years, will further strengthen this surveillance mechanism. What do you think about this scheme? Because it will help us prepare better for any potential pandemic in future, because pandemics are not going to end.
Indeed, these are very, very awesome figures. When you say that out of 734 districts, 730 districts will have those centers, which means that the rapid rate in which we are able to create this kind of facilities also goes to show, even in a country like India where resources are a big issue, if you have a very focused approach and you have an approach that takes into synergy of all that is available at any given particular point and in a particular place, we can do a lot more and we can cover a lot more. I think this is the best positive message that is coming out from what you just mentioned. I mean, covering 736 districts is a very big thing. And along with that, when you think of all other things, particularly if you look at PM Swasthya Suraksha Yojana, where you are going on creating more aims like institutions. And at the same time, we've also seen the kind of attention that is also being paid for creating the resource personnel. That is one of the biggest challenges, the availability of doctors. And the government has been talking of the new medical education policy also, which looks at creating a medical college created at every district so that people from that region itself will, enroll as students and qualify and work in those very areas. Because this paucity of medical personnel is another challenge, which is also an element of the country's health education policy.
I think the absolute return to the fact that preventive health is actually the bedrock of any health system, that let's not fall sick enough to be hospitalized, because that's exactly what India showed during COVID times. Our hospitalization rates remained the lowest in the world. The percentage of people on ventilators, the percentage of people on life support remained quite low, which is why our health systems never got overwhelmed during this whole process. Preventive health, as you also said, will be the focus of all future endeavors, as also of this new project that has been announced yesterday. Mr. Iyer, thank you so much for your time.
Thanks very much.
You were listening to a discussion on Prime Minister Swasthya Suraksha Nidhi and healthcare initiatives for the citizens. The participants were Shekhar Iyer, political analyst, and Aditi Tandon, journalist. This program was produced and presented by the News Services Division of All India Radio. You can listen to it on our mobile app News on AIR. This program is also available on our website newsonair.com. You may email your opinion about this program at airnsdtalks@gmail.com.